COVID-19 can kill people. No one disputes that fact. But government lockdowns and other restrictions enacted during the COVID-19 pandemic can also have deadly effects. John Sanders has been documenting the unintended consequences of these government decisions. John is Senior Fellow in Regulatory Studies and Research Editor at the John Locke Foundation. John, you've been writing about this for months, but you just this week put out a new report asking how much are Cooper's orders to blame for non-COVID excess deaths in North Carolina. Before we get into some of the details, tell us what you're talking about when you're talking about non-COVID excess deaths.
Right. So the Centers for Disease Control and Prevention, the CDC, produce a statistic called excess deaths. And it's a way that they use to determine if something unusual and bad is happening in a locality such as North Carolina per week. So they take a look at how many deaths have occurred in the state in a particular week and compare it against how many deaths on average would have occurred based on 20 years worth of data. And if that level of actual deaths is above the 95% confidence interval, about 100 deaths more, basically, then they assume that an excess death event has occurred. So it's like a 1 in 20 year event, something has gone bad. COVID is naturally one of those things. We have been having excess deaths because of COVID-19 since really going back to late April, I think, or early May of 2020. However, if you take those deaths out, we're still having an excess death event, which means something unusual is going on in North Carolina that has nothing to do with COVID. And that's what I'm asking about in this research brief.
One of the challenges that you run into in compiling the data and trying to make sense of them is that the Cooper administration has been very tardy in getting information to the federal government. Is that right?
That is right. And that's a problem we started discussing last year at this time, and the state was a month and a half behind the rest of the states in the nation in reporting those data. Since then, they've become even more tardy. And at present, we're now over 4 months behind the rest of the states in the nation in reporting these data. And this isn't just a matter of simple laxity that they're just tardy. Because of the things that I'm talking about here, it means that well-meaning government officials can't even tell if something unusual is going on.
We're not going to get into a lot of the details of the research brief that people can find at the John Locke Foundation's website, because there's a lot of intricate detail, lots of bullet points. But let's get into some of the meat of this, which is that you find study after study, report after report showing that lockdowns and other government restrictions put in place to deal with COVID-19 have tended to have many negative consequences.
Yes, and I've been updating those data for a while. Research, we've been talking about it at the John Locke Foundation since at least August of last year, but research has been coming out questioning the unintended negative consequences of government putting healthy people in their homes and closing down their jobs or limiting their jobs, putting all kinds of personal restrictions on schools and people. And it's all to save us from COVID, but there are lots of negative unintended consequences that are coming out from it. Child suicide rates are higher. We're starting to see deaths of despair, drug overdoses, mental health related problems, a marked increase in domestic violence, and a very worrisome lack of policing violence against children in the home, because the first responders, the first people to notice anything going on with that are school officials. And so there's been a drop off in reports, but as officials nationwide have been saying is like, we know there hasn't been a drop off in incidences, and the problem is it's probably worse because everybody's been kept at home. Also worries about greater increase in deaths from heart disease, cancer, diabetes, and stroke from people either not being able to get to the doctor or people being afraid of going to get checkups. Yes, on and on and on. Lots and lots of thoughtful people expressing serious concerns about the long-term implications of lockdowns and these other restrictions.
It sounds like at least some of this, if not much of it, is just because people not being able to go about their normal daily lives are not going through the processes that would have helped them avoid having these types of health issues, like going to school, going to work, going to regular doctor's appointments, other things that you just take for granted that we didn't get to do during the lockdowns.
Yes, and one of the most interesting and tragic things I think that's come out of research recently is a new economic report has come out and suggested that actually before the lockdowns were brought about, these major places of business, schools, hospitals, and they even mentioned Duke Hospital in particular, took on hygienic procedures and protocols that made them safer. And as it turns out, going and being locked in your home and staying at home so long, that was one of the high risk settings, and the schools were not. So if you look at why private schools were doing so well, it's because they adopted so many good protocols, as did hospitals and other places. And so one of the unintended negative consequences is that people were sent to one of the high risk settings with government officials and everyone else thinking this is the safest way for them to be.
I want to turn now to some of the final paragraphs in your latest report, which once again, people could find at johnlocke.org. You say it's disheartening to see evidence of an ongoing non-COVID death event months and months after citing science and data to sound the alarm repeatedly in the hopes of warding off such grim results. And then you add, worse, it's unsettling. It's an unsettling thought that Governor Cooper's insistence on retaining a state of emergency, even now, with no foundation in reason, is highly suggestive that he harbors an inclination to return to this deadly well in the coming months. Good use of language there, but beyond that, a very disturbing thought that if the evidence is mounting that the lockdowns and restrictions are having this impact, it's disappointing, if not scary, to see Governor Cooper continuing to rely on these types of things.
And that is my biggest concern. And I'm trying now to raise awareness. I was hoping to alert the Cooper administration to their laxity and the potential deadly effects of the lockdowns. But, as you know, in November and December, he increased his orders and made them stricter and more stringent against people and against businesses. So, and those effects are not really showing up yet in the data. So we'll see. But now I'm hoping that the legislature and the courts and the court of public opinion will rise up and realize these things are dangerous. And even though we're trying to help people, they have unintended negative consequences. The cure may be worse than the disease.
If you'd like to learn more, you can go to the John Locke Foundation's website and search for the research brief with the headline, "How Much Are Cooper's Orders to Blame for Non-COVID Excess Deaths in North Carolina?" Its author is John Sanders. He is the Senior Fellow in Regulatory Studies and Research Editor at the John Locke Foundation. Thanks so much, John.
Thanks, Mitch.